Good morning, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry, with this week's episode of Dental Health with Dr. C. I'm going to talk about a subject that sometimes is a little embarrassing for people. It's snoring. And does this really cause much of a problem for people, and can it cause problems for individuals? Well, the answer is yes and really yes. What is snoring? You get a reverberation of the soft tissue in the back of your throat as you're breathing in and out. Now, this can cause couples to sleep in separate rooms. This can cause huge embarrassments on an airplane. But aside from the social aspects of it, why do we care? I mean, it's kind of a nuisance and it's something you can joke about around the table. But the truth is that many snorers have a serious condition called obstructive sleep apnea. Now, what the heck is obstructive sleep apnea? Well, it's an incredibly common disease, and it's a disease where the tissue in the back of your throat and the tongue close off the airway. So the patient will be lying there snoring away, and then all of a sudden it stops breathing. It's kind of a... Now, a lot of wives have trained their husbands to sleep on their side because it's generally worse when you're on your back, and sharp elbows will leave dents, and this can modify this behavior. But beyond that, obstructive sleep apnea is a very serious and epidemic disease. It's as common as asthma and diabetes. That being the case, why do we worry about it? Well, to tell you the truth, if you have obstructive sleep apnea, you're not going to get well rested to begin with, but you also have some what we call comorbidity factors, where you're more likely to have a heart attack, stroke, you're 7 times more likely to die in your sleep, it's harder to lose weight, it can cause depression, a whole host of factors. This knee bone connected to. There's a lot more truth to that little jingle than we were led to believe when we were in grammar school. So if that is a situation that you perhaps presented with, how do you know if it's really a serious problem? Well, traditionally you actually go to a sleep doctor and he puts you into a sleep lab where you bring your pillow and they hook a bunch of stuff up to you and they say, okay, show us how you normally sleep. Most people don't sleep that well in that setting to begin with, and they run behind a mirror and they kind of watch you and they see how goofed up you are. They measure your blood pressure, they measure your pulse, how loud you snore, how frequently you snore, what position you're in when you snore, and how often these obstructions take place during the night. Now, if you're stopping breathing more than 5 times an hour, this is a negative impact on your overall health. So, how do we diagnose in my practice? To tell you the truth, the sleep labs do have their place, but for the most part there's a number of home systems that you can use, and we have one actually here at the Coleman Center where you can go home and wear it at night, download the data in your own bed, bring this little machine back in, we plug it into a computer, and a certified sleep doctor interprets the readings for us in about 6 hours. And we have an excellent idea. It measures oxygen saturation, your brain waves, the whole shoot and match. Now, why do people feel tired when they have sleep apnea? Well, the thing is, we're supposed to go through these sleep cycles every night where we go from stage 1, 2, 3 and what's called REM. You may have heard of that, rapid eye movement. And REM is when we get our good sleep. That's when we defrag our brain, our body relaxes, it repairs. And in that state, you're really only supposed to have 2 muscle systems working, your heart and your lungs, the involuntary muscles. But what happens in an apnea, the blood saturation level of your oxygen drops down. Your brain says that's not so good, and it activates some muscles in the throat to free up the obstruction. So it yanks you from that good REM sleep to an earlier part of the sleep cycle. So even though you may get 8 hours sleep, you could wake up feeling exhausted. This is a serious issue. If you figure that 23% of people with severe sleep apnea fall asleep at the wheel of their car every week, how many traffic accidents are involved with this type of behavior? Add that to the fact that it's impacting your overall health, and this is a big problem. So if you think you have sleep apnea, you should be tested. We can certainly do it here for you in the office, or talk to your MD about it. And if you want to find out what we can do about this, well, I guess you'll just have to tune into next week's segment. Dental Health with Dr. C, Dr. Paul Coleman. Feel free to give me a call for a free consultation or visit us on the web at www.drpaulcoleman.com.